Good morning, everyone, and welcome to the RAC Obefit webinar series. Our topic today is surgical intervention in weight loss. Over the last couple of weeks, we've been talking about lifestyle interventions. We've discussed exercise, different forms of exercise. We've discussed diet, different forms of diet. We've discussed medication. Now, when these fail, as they sometimes do, we have surgical intervention. Usually, this is the case when there are comorbidities associated with the weight problem. To discuss this topic today, I am absolutely honored to introduce our speaker, Dr. Shalabh. Dr. Shalabh Mohan is a skilled surgeon. He earned his MBBS. He earned his MBBS in 1994 and MS in general surgery in 2001 from prestigious medical colleges in New Delhi, India. With extensive expertise of 28 years in laparoscopic, general, and obesity surgeries, he has garnered several fellowships, including those from prominent medical associations. Prior to his tenure at RAC Hospital, he worked at renowned hospitals like Mac Hospital and Primus Superspecialty Hospital in India. He has actively participated in various medical courses, conferences, and workshops across India and abroad, including Germany, the USA, Taiwan, Tokyo, and Singapore. His unwavering commitment is to provide personalized medical care to enhance the well being of his patients. To discuss more on today's topic, Dr. Shalabh Mohan, over to you.
Good morning, and thank you for such a wonderful introduction. Let me just start with my presentation right away. Get back to the first slide, please. Yes, is the screen visible?
Yes, Doc. Please put on the slideshow, sir. Yeah, that's perfect.
Okay, so jumping right in. How do I get rid of this? Sorry, I'm still a little new at this. Okay, so jumping right in. We've had a lot of discussions previously in this particular.
Sir, can you put in the slideshow?
Can you see the slideshow?
No, it's in the presentation, but not in the slideshow.
Okay. Slideshow.
Either you can start from the top, there is a slideshow button, or on the bottom there is, yeah, perfect.
Are we fine?
Yeah,
okay,
yeah, perfect.
So very quickly, since you all mostly this has probably covered these topics, morbid obesity is what we are primarily going to talk about today. It's a multifactorial disease, the basis of which is excess fat stored in the body. And we all know that is associated with a lot of serious medical problems. Multiple factors from genetics to the environment to our lifestyle, they play a role. And it is a disease which is lifelong, it is progressive, and it's a big problem. A significant number of the world population today is suffering from obesity, right? And this is a quick look at the proportion of population country-wise, which is now considered to be clinically obese. As we can see, it's a very significant percentage of a large number of the developed world. About a fifth of all the adult population in the world is considered to be obese. And of the remainder, even the ones who have a so-called normal weight, they have a very high percentage of body fat, right? Most of these people will be suffering from some associated comorbidities. So, well, is it normal or is it more above average? Well, that's for us to decide. We seem to be moving towards a tendency towards obesity being considered the normal now because it's so very common. Enormous consequences on the body for if you're clinically obese. Almost every known medical condition has some association with obesity, including cancer. So there's the big three is diabetes, cholesterol, hypertension. Apart from that, heart disease, sleep apnea, the risk of stroke, and obviously mechanical factors which lead to problems with bones and joints, right? Diabetes is one of the most common conditions related to obesity, and it's a big medical problem. Now, who do we blame for this? Well, um, we are fond to find fault with something else. Well, this is how we are made. This is how we've been genetically designed. We have been designed to store fat because we come from the original design for the human body is what we were. Our primitive ancestors had to work hard to get food, and whenever they had food, they had to ensure that they consumed enough to have body stores for times of need. So humans are genetically designed to gain or maintain body fat stores. Now, the kind of civilization we are today, we have the same kind of a body, but now food is guaranteed. The physical exertion that we subject our bodies to is very, very limited. So, even when food is in plenty, the same design of a body ensures that we continue to store fat reserves. And this is how we as a species are evolving. And I'll quickly move forward. A brief note on this particular hormone called ghrelin. It's secreted by the stomach, and it plays an important role in controlling our hunger drive, our satisfaction, and also it is a very important hormone when we consider surgery for weight loss. This is a hormone which increases when the stomach is empty or when the body glucose goes down. It drives us to consume food. It gives us a sensation of hunger. When you consume food, this goes down. Now, this is important because when we put patients on a diet, the body doesn't recognize this as a diet for weight loss. It just recognizes a time of starvation, and it increases the ghrelin levels, basically increasing the drive to eat. So when you're dieting and you have these cravings, now you know where they're coming from, right? And interestingly enough, post-surgery, this drive to eat is significantly reduced because this hormone also goes down after surgery. Well, clinically obese individuals are those who have a BMI more than 30. It's a way to measure how your weight is affecting your health, and it's measured using your height and weight parameters. And as your weight increases, this is an interesting graph. As your weight increases, as your BMI increases, the risk of acquiring other diseases will also go up. And as the heavier you are, and for the longer duration that you are obese, your lifespan is going to significantly reduce. So what are the management tools that we have to reduce weight? It's diet, it's exercise, it's behavioral therapy, to some extent medications, and finally surgery, right? So this is an interesting graph which shows how patients are years after they undergo a surgical procedure. As you can see, in comparison to more conservative methods, patients who undergo surgical procedures are more likely to sustain the weight loss beyond 5 years. So the most difficult part of losing weight is not the loss itself, is the need to sustain that weight loss over time. That is where the real challenge lies, not in dieting or exercise. This is one thing I'm very fond of showing all my patients. In one picture, it says almost everything. It shows you how obesity is going to affect each and every part of your body, right? Starting from head to toe and dealing with diabetes, hypertension, heart disease. It affects your lungs, it affects your bones and joints, it affects every organ. And along with that, the other thing which it shows is when you lose weight, especially after bariatric surgery, what is the percentage of resolution of these diseases? And this is most interesting, especially when I talk about diabetes and cardiovascular disease. There, a majority of patients, almost more than 80% of patients with diabetes following weight loss surgery, and I'm talking only about surgery, tend to have resolution of diabetes over and above just simple control. There's a difference when you have diabetes or hypertension. You need to control the disease. You need to take medications all your life. With surgery, there's a very good chance that you don't just have control, you have complete resolution, which means no more pills. So when do we talk about surgery for patients? The guidelines are very clear. If you have a BMI more than 35, with one or more significant comorbidity, which is blood pressure, diabetes, right? Or if your BMI is greater than 40. Apart from that, there are some relative indications, especially if there's a failure to lose weight even after several attempts, and your weight is now causing a significant change to your lifestyle or your health. I'll go on to the next. So what are the surgical options? You need to understand that weight loss surgery works in essentially three ways. One, it causes restriction of the amount of food that you can consume. Two, it reduces the amount of absorption of calories, which basically means the amount of fat which is eventually stored in the body. And third, and the most important, is it also alters the hormonal environment within your body. And that is where the secret lies in the resolution of comorbidities like diabetes and hypertension, right? So, of the most common surgical options, the one is a sleeve gastrectomy. It's fairly simple to understand. We simply reduce the capacity of the stomach. We make it like a sleeve with 80 to 90% of the gastric volume being reduced. The other thing that you see, which is the lap band, is no longer in vogue. It is very few places do practice the surgery. It's not doesn't have much favor because the results were not very encouraging. Then there's a combined malabsorptive and restrictive procedure, of which the most common is the first image that you see, which is Roux-en-Y gastric bypass. It looks a little complicated, but essentially what happens is we reduce the size of the stomach. We divert the food that we consume from the stomach into a distal part of the intestine, bypassing the more efficient absorptive portion of the intestine, thereby reducing the absorption of nutrients. So, what is the effect? What is of weight loss surgery? This is basically a section of the same image that I showed you previously. So, 84% resolution in diabetes, 95% resolution in dyslipidemia, high cholesterol levels. It affects your quality of life. It's not just the diseases which are resolved, right? There's a marked improvement in your personal appearance, your sense of well-being, your social function and body image. And yes, it does make a difference in your personal, professional relationships. It enhances productivity, you're fitter, right? And it has been shown to increase your economic opportunities. Like it or not, if you're obese, your chances of economic improvement are considered to be worse than someone who has the same skill sets and same qualifications but is not obese. This is many studies have shown that. And the effect of bariatric surgery on diabetes is the one that most surgeons all over the world are interested in, because it has a marked change in the patient, even if there's not complete resolution. It's much more easier to control the diabetes. Your need for medication goes down significantly. And this is something, the only proven option for long-term resolution with superior results compared to best medical management. Now, these words are important in selected patients. And this is something which has been validated by medical bodies worldwide, not just surgeons, diabetologists, endocrinologists, cardiologists, all of them. But weight loss surgery comes with a lot of apprehensions from the patient side. When we talk about surgery for weight loss, the approach is, now this is a very radical procedure. Is it something that I actually need? What's my life going to be like after this? And why do I need to do something so major? Why don't I try better options first? Well, the answer to that is it's not as radical as people think it is, right? So we'll talk about a lot of misconceptions people have. Well, the first, obviously, it's a dangerous surgery. Actually, no. Every surgery carries risks, and the risk profile for any surgery depends not just only on the surgery, but also on the medical condition of the patient, right? With modern practices, with advances in anesthesia and laparoscopic surgery, these conditions are considered relatively safe. And I tell all my patients, when it comes to any surgery, the only reason to do a surgery is because the estimated risk of doing the surgery is much less than the risk of not doing it. So it's far more dangerous to live life being morbidly obese. Consider this way, if I have to operate on a patient who's morbidly obese, I have to remove his gallbladder. He's got multiple medical conditions related to that. That operation is probably as risky as a bariatric surgery, no more, no less. It's mainly because of his medical conditions, which makes this surgery risky. A very common apprehension. I can't get pregnant if I undergo the surgery. If I have a baby, the baby will have problems. That's not true. Morbid obesity affects each and every single parameter of fertility, right? Starting from your hormonal drive to your libido to your performance to your possibility of conceiving, your possibility of having a healthy pregnancy. Morbid obesity adversely affects everything. If you lose weight, even if it's by weight loss surgery, you are more likely, you're more fertile, you're more likely to have children, you're more likely to have a healthy and safer pregnancy, right? If it's just about weight loss, why don't I just go in for liposuction? The surgery is a medical procedure. It's not done as a cosmetic one. Liposuction is a cosmetic procedure. It's done to reduce subcutaneous fat to make your body shape look better, right? For example, you got these little love handles on the sides, and no matter how much you exercise, they just don't go away. Liposuction is the answer. It is contraindicated by the all plastic surgery societies to be done in patients with a BMI higher than 30 because liposuction can be dangerous. It produces about 6 to 8 kilos of weight loss at the most. It's not what people need if they are morbidly obese. They need to lose much more. And losing fat, which is accumulated under the skin, is not really going to affect your health. It is a fat which is choking your blood vessels, which is clogging the tissues around the pancreas, the heart, and the lungs. That's what we need to reduce. I weigh maybe 10 to 15 kilos. Maybe weight loss is a quick and easy way to lose that, get back to a healthier procedure, get back to a healthier weight. Well, that's not right. It is a procedure. It carries certain risks. You need to take on those risks only if you're sure that the benefits outweigh those same risks. If you don't fit into the criteria, other options are available to you. Specifically diet, exercise, lifestyle management, all of those are there. So weight loss surgery is not for everyone. Now, I particularly hate this concept. You're obese because it's your fault. It's like telling a diabetic that you're diabetic because you consume so many sweets all your life. That's not right. Obesity is a disease. It needs to be classified as such. When I look at a person, I can't tell from their face whether they're diabetic or hypertensive. But everybody knows obesity in a patient because, well, it's there for everyone to see. So this concept that fat people are just, it's their fault and they're lazy and they eat too much and they don't exercise and therefore they're obese. Not true. Lifestyle does play a role, but like any disease, you can't blame the patient for it. There's multiple factors, your genes, your environment, a lot of things which cause clinical obesity. The real fear is, will I be able to eat normally? I mean, food is so important. Each and every single social function from birth to death involves food, right? We celebrate with food, we mourn with food, we comfort ourselves with food, or we just eat because we want to. So to feel that you may not be able to eat properly again is a big limiting factor. It's a big fear. So you need to be reassured that it's not so. When you undergo the process of weight loss surgery, once you've lost your weight, you're a normal person. So you eat the same kind of food that your friend will. You will attend parties. You'll probably go out. You eat the same food. You'll probably eat less. You'll probably make a few more healthier choices. But that's it. Otherwise, there's no different. I mean, two people at a table, one person can probably consume an entire pizza. The other is happy after two slices, right? But both of them are equally satisfied with what they consumed. So after weight loss surgery, you can be a normal person, eat normal food. The other caveat, I've had a surgery. Now I can eat anything, I can enjoy my life. Nothing's going to happen. Again, not true. Weight loss surgery is a tool. It's how you use that tool to better your life depends entirely on you. If you think that now that I've got the surgery done, I've lost weight, I don't need to take care of myself, that's not right. But it's important to understand the amount of care that you need to take for yourself after weight loss surgery is no more or no less than the normal person next to you who is not undergone the surgery. Everybody needs to follow certain rules to live a healthy life. The same rules apply to you. The rules are not more strict because you've had a surgery done. So where do we start? Once we decided that this is a patient who is a candidate for surgery, who needs surgery, what's the process? Obviously, the most important thing is speak to your doctor. Understand the pros and cons, the various alternatives, the other options for weight loss, which is the best one for you. This is not a decision to be taken lightly, neither by the surgeon nor by the patient. It involves a certain amount of commitment, and it is to be taken only when we are very sure that no other way is possible. Right? There's a very detailed evaluation before we proceed for surgery. What are the previous treatments that anybody has undergone for weight loss, any ongoing medications, what's the patient's social, personal, family life like. So all of that is important. We measure the standard parameters, your blood pressure, your heart rate, your body weight, your height. We do BMI analysis. The basic blood work which is required before proceeding with any surgery, right? Your liver function, kidney function, your hemoglobin, blood sugar. We need to know your metabolic profile because that's what we set out to change. What's your HbA1c? How well is your sugar controlled? What's your thyroid function and lipid profile? We are going to change your diet, and we're going to change the way you digest your food. So we need to know where we're starting from. Your nutritional profile is important. So iron studies, vitamin levels, your serum calcium and protein levels, all these are important. Now, the interesting thing here is we assume that once we undergo the surgery, we will suffer from malabsorption and we will have deficiencies in vitamins, maybe other minerals. A large proportion of people who are morbidly obese, even before the surgery, they have deranged nutritional profiles. They almost invariably, all of them have low iron or vitamin D stores. It's because their metabolic profile, the way they digest food or process food, or the lifestyle and the restriction to have an active lifestyle, all these contribute to a deranged nutrition profile even before the surgery. But once we know what we have, once the surgery is done, we can always provide supplements. I tell all my patients it's easier to pop a multivitamin pill than to take 3 or 4 medications for your blood pressure and diabetes, right? So, any other investigations which are specific to a patient's medical profile or history, that's done. There has to be a cardiac assessment because we need to know how well the body will respond during the surgery, how fit it is. A pulmonary assessment because, again, your lungs have to be in fit condition, right? An abdominal evaluation. Sometimes we need to do an endoscopy on the patient. And it's not just the surgeon, it's an entire team. If there's a pediatric surgeon, there has to be a cardiologist, an endocrinologist, a dietitian. All of these people will be consulted during the process so that the outcomes are always the best possible. I highlight the role the anesthetist because he has a very, very important role. He's the one who's going to keep you safe during surgery, right? The surgeon, he just does a job. It's the anesthetist who manages you, manages your problems, your heart rate, your cardiac function, your breathing during surgery. I think he's the VIP of the team, right? The others, as and when required, you'll need a pulmonologist, a gastroenterologist, maybe even a psychologist, because this surgery requires a certain significant mental adjustments as we go along. What to expect on the day of surgery? Well, you'll arrive to the hospital in the morning of the surgery. Somebody from the staff will meet you, take a quick history, put in an IV line, certain preoperative medications are given. You'll meet the anesthetist again. This is done obviously under full general anesthesia, so that means you'll be under anesthesia for 3 to 4 hours. Once the surgery is done, you're sent to a recovery room and you're fully awake, right? We follow what is known as the ERAS protocol, which is early recovery after surgery. So our entire preparation is based around ensuring that the patient has a very quick recovery. The quicker the patient is on his feet, eating food, and going home, the better results is what we see. So starting from the medication given in the pre-op to the medicines and the drugs given during surgery, we want to make sure that you're comfortable, you're sleeping, you're not in any pain, but we also don't want to give you something which will leave you heavy sedated or nauseous when you wake up, right? Patients, when they undergo the surgery, typically they're up and walking 4 hours after the procedure, right? They start taking oral liquid sips on the first day itself. We encourage them to go to the bathroom. We don't like them using a catheter or using a bedpan in bed. We want them moving. Most patients go home by the second, third day. Now I'm going to show you a quick video of what is it that we actually do inside. And I'll run it along as well. It's a laparoscopic procedure. We make little openings in the abdominal wall. We put in our instruments and we get to work. So this is our digestive system. The first thing in a gastric bypass is we reduce the size of stomach. We make a small pouch, and this pouch is about 50 to 100 ml. I know there'll be a lot of concerns. Is it big enough? We'll get to that later. Then I detach a small portion of the intestine about 3 or 4 feet away. And then this is attached directly to the small gastric pouch, which means food enters this portion of the intestine directly, bypassing most of the stomach and the initial few feet of the intestine. And the digested juices coming from the stomach and the pancreas mix up with the food far away, which means there's less absorption of nutrients. This is what a bypass is. It's a little complex at times to appreciate how it actually works, but this is considered the standard surgery for weight loss. The other is called a gastric sleeve. Now, this is fairly simple to understand. Okay. So in this procedure, all that is done is we reduce the gastric capacity, but it's not all that simple. It is very, very important to eliminate that portion of the stomach which is producing ghrelin, the hormone that we spoke about earlier. That is the hormone which is secreted by the stomach, which controls your hunger drive. So a surgery for a sleeve gastrectomy, is not just about reducing the stomach size, it's also about eliminating that portion of the stomach which produces ghrelin. And that is how it works. So what happens after surgery? The most important concern is your diet. Now, I call this the baby analogy, right? We all remember kids. You had kids yourselves, many of you, or how you were as a child. When a child is born, the child cannot consume or chew anything. The child is not designed to eat, say, bread, right? But here's the thing, all the child needs is his mom's milk. The child does not suffer because he or she is only consuming milk and is not able to consume something else, because that's all that he or she needs. Then, as you progress forward, as the child grows, his needs will change and you will keep adding to his diet till he moves to what we call a normal diet. So at the end of a year, the baby's chewing food, swallowing food, and that's how it is. It's very, very similar when we do the surgery and the dietary phases following it. It's the same you, but with a new digestive system. So your digestive system has to relearn the process of how to process food. So in the first couple of weeks, it's clear liquids only. Again, apprehensions arise. Now, if I'm only taking clear liquids, is it sufficient? Am I going to feel weak? Actually, no. You'll actually feel much better. You'll start feeling lighter, probably fitter, and more energetic. It's because this is all that your body can manage at this point in time, and this is all that it needs. We will progress on an average, it's a 2 week cycle from clear liquids to thick liquids to pureed food to soft diet and a normal diet. Basically, all those phases that a baby goes through, right? What happens if a baby is forced to eat something that he's not designed to process? He's going to have pain, he's going to vomit. That's what's going to happen to a patient of bariatric surgery who tries to eat more than he can or something that he's not supposed to at that point in time. He's going to have pain, he's going to vomit. Now, we hear a lot of bad reviews about weight loss surgery, mainly because once a patient has surgery, he can't eat anything, he's vomiting all the time. That's because that patient hasn't understood the process fully. You need to be patient. At the right time, the right food. Once you are done with the process, once you've completed it, you can eat normal food. If you test your stomach, no matter what my gastric capacity, even if I haven't had a surgery, if I try to forcefully eat more than what it can hold, I'm going to vomit. That's the same thing. The difference is I might feel nauseous after an entire pizza. A patient of bariatric surgery would probably feel nauseous after 1 or 2 slices. So understand the process. That's more important than even getting the surgery done. If you understand the process and you are able to deal with it better, you get much better outcomes. The focus of the diet is always going to be on low calorie and high protein. This process, what is the purpose of this? Basically, we are trying now to mobilize your fat stores. The surgery doesn't pull out the body fat. It simply changes your metabolism and your digestive process. So all those excess fat stores which were there in the body, we want to consume them as quickly as possible to get you to a healthy weight without making you sick. So in this entire process, you will be in a calorie deficient diet. You'll be consuming less, you'll be burning more calories from your fat stores. So it'll be low calorie, high protein. You'll be hydrating well. 1.5 liters of water every day. Small, frequent meals, obviously because the stomach is small. Avoid carbonated drinks. That's very important. The gastric pouch, the volume of the gastric pouch plays a very important role in your weight loss and in your sustained weight loss for the rest of your life. But like I said, it's a tool. It's how you use it. If you start eating, if you start testing its capacity, you start stretching it out. It's something which can stretch. There are a lot of patients who do tend to consume a higher volume of food as they go along over the years. that stretches out your stomach. It's basically going to bring you back to where you started from. So you need to avoid anything which is stretching your stomach, particularly carbonated drinks in the first few days. No large bites of food, again, because your mouth capacity is good, but your stomach cannot take so much. Always remember gastric capacity. Exercise is a very integral part of it. Now, morbidly obese people, it's easy to tell them to go and exercise, but they do face physical limitations in exercise, right? Once you start losing weight, it becomes easy to stay active. Standard exercise, nothing very special, nothing, you need a special trainer or something. No, it's all something that you can do at home. Normal walking, cycling, swimming. Understand the process. You're losing weight, but at the same time, need to build up your muscle mass, because if you have an increased muscle mass, you will burn calories faster. You will stay more mobile, right? So you need to increase strength training as well. Isometric exercises, small weights, all those things. Anything that you can do at home. That's also the same reason why we encourage a high protein intake, because we want you to improve your muscle mass. Stick to a daily routine. I don't need patients to go to the gym for 4 hours a day, but I do need 30 to minutes to 1 hour of exercise, and that's the advice we would give to everybody, not just someone who's undergone the surgery. So I basically need patients to follow a normal healthy lifestyle, nothing extra, nothing special. So what kind of weight loss can you expect? What happens? Typically, patients lose anything from 4 to 8 kilos per month. That depends upon what kind of excess weight they've started out with, what the BMI was, right? It is also gender specific. Women, unfortunately for us men, tend to lose weight much faster than men, right? So a lot of male patients do tend to get discouraged. Why is she losing weight faster than I am? Well, that's just what it is. The weight loss is faster in the earlier days. It's an accelerated process which slowly, slows down. And usually your weight will plateau over the end of a year to year and a half. Again, the same words that I'm going to remind you of. This is a tool. So how well you have been with yourself over this first 1 year is going to determine what weight you're going to plateau at. And that is what is going to stay with you, give or take 5% for the rest of your life, provided you follow the same healthy lifestyle. So most people, if they follow these basic rules, can expect to lose over 80% of their excess body weight. It's simple mathematics. If I were to tell a patient, if I were to give you the maths behind it, every excess kilo of weight is, if you assume that it is body fat, 1 kilogram of body fat represents, on an average, 10,000 calories. So if I am 10 kilos overweight, I need to lose 100,000 calories. Sorry, 100,000 calories. If I'm 50 kilos overweight, I need to lose 500,000 calories. Now you understand the challenge of depending only on diet and exercise for people who are morbidly obese. If someone runs on a treadmill for maybe 30 minutes, he's going to burn 350 calories. After that, if he consumes a cookie and an orange juice, he's back to where he started from. So the higher this weight gap, the more unlikely you are to lose sufficient weight with only diet and exercise. So, like I said, it's not easy. It's not the easy way out. It is to be done only because you want a healthy lifestyle and now you tried all other options. It does require major adjustments to lifestyle. In the early days, there'll be bloating, there'll be reflux and vomiting. You need to be patient, understand the process, and follow through on it. An interesting thing, in all my years, it's been, I think, close to 15 years of doing weight loss surgery. I have yet to meet one patient who, in the first few weeks of this surgery, does not come back and tell me, I think I made a mistake. Because it's difficult to adjust. But every single one who's completed the process has usually ended up very, very happy with the outcome. This is a time of significant change in your body. You can see it, people around you can also see it. This involves a lot of emotional upheavals as well. There's a psychological stress on you as this process goes on, right? In fact, there are some very interesting studies coming out of America which suggest that the divorce rates go up after bariatric surgery. Hopefully, that doesn't apply to most of our patients. It requires adjustments from the patient, from the family, and the patient support system. The important thing is understand the process, stay busy, stay happy, enjoy it, enjoy the change which is happening. It's definitely worth it, right? Your fitness levels improve, your life span improves, you have better stamina, you have better mobility and balance. All your medical problems have significantly reduced or they're completely gone away. There's a whole new look, and you have a healthier, longer, and more productive life, right? I'm going to show you a few photographs of patients who have undergone this. These are very old photographs, some of the more than 5 years old, and I do have the consent to show that to my patients. Basically, normal people living normal lives who undergo significant transformation, right? This is how they are, all age groups, middle-aged, very young, very old, right? It changes. The most dramatic change, obviously, is the change in your overall body shape and how you look. It does wonders for your confidence, but more importantly, it does fix your health issues. And that's it. Thank you.
Every time I hear Dr. Shalab speak, I learn something. I learn to see things and question myself. And it's absolutely fascinating. So, one of the first things you talked about was how we see an overweight person and we automatically assume that they're lazy. And then you've explained to us how many calories we'd have to lose. Can you imagine how not possible that is? And to understand that obesity is a disease and it needs to be treated such. It's not lazy people. It's a disease. It's fascinating. I love the we're genetically designed to gain and maintain. Fortunately for me, I got my grandmother's genes. So, but honestly, yes, we don't understand that we were trained to gain and maintain, but now food is in abundance, but we still function the same way. Our body still functions the same way to gain and maintain. And so you've underlined the importance of diet, but also the metabolic, the entire syndrome that goes with obesity. That was absolutely fascinating. The other thing that I found absolutely fascinating was people talk about cosmetic like as if it's not important, but there is an economic factor to cosmetic.
Yes.
It increase. I mean, when you're overweight, yes, as a recruiter, I know when I see someone that's overweight, I make, unfortunately, certain assumptions about
You make judgments.
efficiency.
You make judgments about how
Absolutely,
the patient is likely
absolutely.
to perform because he is probably lazy. He's obese.
It,
He's lazy.
yep, exactly. It made me question myself at so many levels. And the other thing I really hit home with me was morbid obesity is worse to live with than the risk of the surgery. So true because it affects the big threes. It affects your mobility. I mean, it's a catch 22 because you're obese, it's difficult to exercise. You don't exercise, you get more obese. Absolutely, absolutely fascinating talk. Before we go into question and answers, thank you so much, but I will be back. Dr. Wilku, over to you.
Thank you, Ms. Arina. Thank you, Dr. Shalab Mohan, for a wonderful session. Really, it was very nice. And you have mentioned a few things which I liked very much. Like you said about we are designed to store fat for our physiological purposes. Second thing, you spoke about liposuction as a cosmetic intervention and the surgery, the bariatric surgery. And we come across many questions like you have shared a wonderful photographs of your patients, which gives a motivation to other clients also. And if they are struggling for weight loss, if they're not able to do weight loss by lifestyle medicine, and if they have some comorbid conditions, then I think they should be opting for this. This is wonderful. So I have few questions, and in between I saw people. Okay,
Yes, I can.
let's see. First question I will take it from Surprise. Many people go for tummy cut surgery. Is it
That's right.
the same? Bariatric surgery is the same as a tummy cut or what?
Understand, tummy tuck is the same. It's a cosmetic surgery. It's a body
Mhm,
shaping surgery, not a medical procedure. The tummy tuck
mhm,
is going to just stretch your lax skin and reduce some fat from around your belly under the skin. It's not going to affect your health. And let me put it in perspective. Again, plastic surgery procedures are considered risky in a BMI more than 30. This is the guideline from the American Society of Plastic Surgeons, right?
mhm,
If a patient comes to you with a BMI of 35 and says, "I want a tummy tuck because I think I want to lose my belly a bit. I will reduce my belly a little bit. I don't want to lose a whole lot of weight." A good plastic surgeon would probably say that it's a risky procedure, maybe not for you because your BMI is outside what is considered a safe limit.
mhm.
If you
Yeah,
want,
true.
it's a body shaping procedure. Cosmetic surgery and medical procedures are two very different branches. Both of them have their own place. It's a very good procedure, tummy tuck, especially for people who want, see, improved body image is important. It's not any less of a necessity for anybody, right? But you need to understand what you need, what is the exact requirement of your body. Tummy tuck is not going to make you medically fit. And if
Yeah,
your
that's what I was
BMI is high,
going to
it's a
say.
risky procedure.
True, true. And same similar question from Fatima: is bariatric surgery safe for health? Like I saw the last statement from Susan also. She is scared
See,
of.
I'll tell you one thing. As far as
Hmm,
bariatric surgery goes, the safety profile is as good as any other procedure. Think of it this way. The first and most essential criteria when we talk about risk in surgery, it's a relative risk. There's nothing like zero risk surgery. It doesn't exist. There's nothing like a zero risk car drive. You step on out on the road in your car. There's always a risk. What do? We take all possible precautions, right? Starting from, is the driver well trained? Does he have a license? Is he aware of the road rules? Is your car in fit condition? And finally, are you following the right rules, right? But that is not a guarantee against accidents. So the same thing applies to surgery. It is a low risk procedure, not zero risk, and we do everything possible to mitigate those risks. At the same time, if you're a patient undergoing surgery, you need to ask yourself these questions: is this surgery less risky than not doing the surgery? What am I doing and what is the medical team doing to reduce my risk? And finally, there's a risk. If something happens, can this medical team handle that problem? So those are the questions patients need to ask.
yeah, true. And similar way, Mahesh has also asked. He is 30 years. His BMI is above 41, and he doesn't have any family history or medical history of chronic disease. He wanted to do surgery, but as he has seen, many people are gaining weight back after bariatric surgery. So he is little bit
Okay.
means in a dicey condition. Yeah.
The biggest uh, fear is obviously what we see around us. If you see patients who undergo the procedure and they're regaining weight, okay? Here's the thing:
Hmm.
if you do nothing about it, nothing is going to happen. You have to do something. So to
True.
say it's I'm not going to do something because people can regain weight, well, first you need to lose weight, right? You need to understand the process. And if you understand the process and you follow those simple rules, there's no reason for you to gain weight. It's simple mathematics. You consume, you burn up, or you store. If you start storing too much, you will gain weight. So the idea of the surgery is to get you to a healthy state. To maintain that healthy state is on the patient. You have to do it.
Yeah, true. Even not only going for a bariatric surgery, after that they have to maintain their what the health what they have achieved with the surgery.
And the
They should
effort,
not again go back
yes,
on eating and doing a sedentary lifestyle.
yes. So the
That is
effort
for
of
sure.
maintaining that weight is no more or no less than the effort required by any other individual to stay
True,
healthy.
true. And what about gastric balloon therapies?
Yes, I was expecting that question because it's a very very popular thing these days. So understand
Hmm.
this, and treatment for weight loss involves diet, exercise, lifestyle modification, surgery. That's it. The others are considered to be adjuncts. So let me put things into perspective. I will talk about two things: medicines, particularly Mounjaro, which is an excellent medicine coming up these days, and the other is the gastric balloon. Now, the gastric balloon is basically you fill up the stomach with something which stays there, doesn't get absorbed. It reduces your gastric capacity. Okay. Now, understand this. This is obviously temporary. The gastric balloon can reduce maybe 10 to 15 kilos of weight, no more than that. The gastric balloon was primarily designed as a bridge to surgery. Whatever method you choose for weight loss has to fulfill certain criteria. Whatever you choose, the balloon, the diet, exercise, even surgery. Number one, obviously, you have to lose sufficient weight to make an impact on your health. Number two, once you lose that weight, you have to be able to sustain it. And believe me, that is more difficult. And number three, whatever method you choose has to allow you to live a normal life. Okay. So if I say exercise morning to night, drink only bread and water, drink only water, eat only bread, and that's it, do nothing more. Well, you might lose weight, but that's not the way. You need to see to your work, you need to see your family, you need to have a life, right? So everything in its proper place. Another analogy: when we have diabetes, if I start having a mildly increased blood sugar, my physician will tell me, watch your weight, start exercising, improve your diet. My blood sugar gets worse, he'll say, take this tablet and be more careful, but continue with the diet and exercise. I get even worse. Now I have problems with my eyesight or my kidneys, maybe, right? Or I am starting to develop heart disease. Sugar is not coming under control. My physician will say, now you need to take insulin, but you still need to take those medicines and you still need to watch your diet and need to exercise. So these are junks. So the degree of disease will determine the kind of treatment, not what you and I would like. I would like to do a lot of things, but it is my disease which determines how and what I need to do to treat it. So the gastric balloon is going to be, it will help you lose those 10 to 15 kilos. It will give you that initial impetus if you're trying to lose that weight. Not necessarily good for morbidly obese. Your BMI from 45 may come down to 40. But is that what you need? You need more than that. Plus, this balloon has to be removed within a few months, 6 months maybe. This balloon causes problems. It can cause this increased sensation of heaviness, fullness. It can cause severe gastritis. It can cause reflux. So you need to understand these problems. I'm not saying it's a bad option. It is an excellent thing, but for the right patient, not for somebody with an extremely high BMI, right?
True.
Coming to medical therapies, say Mounjaro, for example. Now, Mounjaro is among those drugs which is actually producing significant weight loss, and it has very few side effects as compared to the previous drugs. The most important used to be severe nausea or vomiting, right? There is that with Mounjaro, but it is definitely less. Maybe at some point in time there will be some drug which will completely replace weight loss surgery. But Mounjaro also has certain limitations to the amount of weight loss that can be achieved. It has limitations as to how long can you take it. We still don't have long-term studies on patients who've been on a drug for many, many years, what it does to the pancreas, for example, right? And when you stop this drug, you're going to go back. Plus, resolution of comorbidities is a very, very important part of weight loss surgery. Is it resolving your hypertension, your sleep apnea, your diabetes? So these are important. They help, but they are not replacing weight loss surgery. You need to choose the right patient for the right treatment.
True. Doc, I received two questions, which is very interesting in my WhatsApp actually. So there is one, why bypass surgery, where direct connection with the esophagus to duodenum is being made and stomach is being left out. The person who is asking is concerned about, because stomach is left out, the gastric juices will be continued being discharged. So will it harm your body or it will not be harmful thing?
Okay, I do get this a lot. I mean, why fool around with something which is supposed to be natural? But don't understand, it is natural, but it is nature who designed us to gain weight, right? So now we have to modify our nature a little bit. And again, it is the need which determines the method which is being used. As far as this is concerned, see, the digestive process is what? We consume food, it mixes with the digestive juices, it passes through the intestine, we absorb those nutrients, and that is what digestion is. We are merely modifying the process, right? We are reducing the amount of food that you're consuming, right? And by reducing the amount of food, we are also trying to ensure that even though you're consuming less, you are satisfied. So see, this process of being satisfied with what you eat is very unique to human beings. If I'm not happy, I'm not going to, feel happy. I'm not going to sustain that. So if I'm on a diet which is not keeping me happy, well, I'm not. I know I'm going to start cheating, or I'm going to stop it eventually. So the need to feel hungry, the need to enjoy food, and the need to feel satisfied is essential for our well-being. When you're on a diet, you will feel to some degree. A lot of people will feel dissatisfaction, right? They will feel the urge to eat. So the bariatric surgery does change the way the hormones interact between your digestive system and your brain. It helps produce early satiety, which means early satisfaction. You eat a small amount of food and you're happy. Some people need to eat a full pizza before they say, okay, now I'm really satisfied. I'm happy today. For some people, one slice is enough. But the feeling of satisfaction is important. So that's what it does. Um, Again, when we say we are bypassing the stomach, it's not really unnatural. The process of digestion is still the same. You're consuming food, it is mixing with the digestive juices, you're absorbing it. We're just changing the efficiency of it and the capacity, right, to bring you to a healthier state.
True. Okay. And the second question connected to this, what is, in your view, is much suggestible? Sleep or a bypass?
Okay. Let's put it, I'm going to go back into history a little bit. Okay, because this surgery developed in the 1960s, and it was seen that patients who underwent a gastrectomy for other diseases, for cancers and ulcers or whatever, they would lose significant amounts of weight, right? And that is where the surgery first started, because of morbid obesity was becoming a recognized medical problem around that time. So the standard surgery for weight loss is the gastric bypass. It is what we call the gold standard. It is what we compare all other procedures against, right?
Hmm.
And the pros and cons of all the procedures combined, the data, and this data is for more than 60 to 70 years of data, suggests that this is still the best available procedure in terms of outcomes, in terms of complication rates, in terms of long-term problems, all of those. The sleeve gastrectomy, interestingly enough, was also designed initially not as a primary procedure, but as a bridge to bypass. Patients who are very, very morbidly obese, they are high-risk candidates for surgery. So we need to reduce the risk. One way it was considered is to let's break this operation into two steps. One, reduce the gastric capacity, and then produce an element of malabsorption. So the surgery would become shorter, quicker, and therefore safer for the patient in high-risk individuals. So the sleeve was done. Then the surgeon would wait for a few months. When the patient came to an acceptable weight, he would complete and do a bypass. Over time, people realized that this works almost as well, right? So this became recognized as a standalone procedure. But the sleeve, I would describe it as, it'll do all the things that you need for weight loss, for comorbid disease, but it'll be a little less than the bypass. If that is 100%, this would maybe be a very close 90 to 95% of what is required. So for some people who are younger, maybe a little fitter, who have less comorbidities, the sleeve is a good option.
Yeah, that's a good answer. Actually, now summarizing the entire webinar, if I ask you, just give me one statement that who is the right candidate for the surgical intervention to cover up everything, and who should do it.
Very clear guidelines. The first is practical guidelines, medical guidelines, BMI more than 35, with comorbidities, which are directly affected to your weight, which is if your BMI is high and you have diabetes and cholesterol or whatever, which has come on as you gain weight, right? Or a BMI more than 40, with or without comorbidities. Apart from that, you are a patient who has seen the way your weight has increased, you have made attempts at weight loss, and now you realize that you reached a point where lesser options or smaller options or simpler options are not adequate for what you need. It's need based. It's not my job to convince a patient you need surgery. The patient should feel the need that he needs to do something now for his weight, right? That is a
Yeah.
committed.
Yeah, true. First, the patient has to understand the need, and then the some consultants are there to guide them properly. Yeah, from my side, thank you very much. It was a wonderful session,
Thank you.
especially when you shared the photographs of the clients. That gives a real motivation for those who are little bit hesitant of that. That was a good thing. Thank you, Dr. Shalabh Mohan. Ms. Zarina, over to you.
Cannot thank you enough, Dr. Shalabh Mohan. Cannot thank you enough for this
Thank you.
talk. Thank you so much for your time. Um, Thank you to the RAC Hospital. Thank you to Arabian Wellness. Thank you so much to our viewers. I encourage you and wish you all the very best in your weight loss journey. Join us again next week. So, as you can see on your screen, next week we'll be talking about obesity as a health burden. That will be on the 25th of May at 11 a.m. So, thank you all once again to the entire team, Dr. Mohan, to our viewers. Have a wonderful day.
Thank you.
Thank you.